9/22. That's the date today, the 22nd already. 9/22/09, or as I like to phrase it, 9/22/9. It's the 9th year. We are going to spend some time tonight with one of the most remarkable men in the fight, the battle, to give you freedom of choice and how you address disease issues, most notably cancer, in your own body. You would think that as sentient beings, we have the God-given right to choose what would best serve our interests and our ideas of therapy, treatment, recovery. But not true. We are all captives of a terrible medical pharmaceutical cartel, which views human life as essentially worthless and as revenue-generating units. I don't know what the average cancer verdict is now in terms of cash in their pockets ultimately, but it's got to be close to $750,000. I know years ago it was between 4 to 500,000 if I remember correctly. It's a big business. There is a book out there which every single American needs to have. You all do, because 1 out of 2 of you is going to deal with cancer. And that means even if you aren't the one, you'll know someone who is. And you will be able to hand them in a book and sit down and discuss with them the choices that medical science will deny you. Point of fact, some of the people who have created the alternative therapies, which really ought to be mainstream, have of course been persecuted to death, been imprisoned, had their lives destroyed, and so on. The book is called Cancer, Step Outside the Box. Ty Bollinger is the author, and Ty is with us tonight. Are you there, Ty? There he is. You there?
Yeah, I'm here, man. I apologize. I lost power right as I was about to get on here, and being that I'm talking to you through an internet phone, that pretty much takes care of my phone line.
Never use internet phone for radio programs. That's rule number 1. It is seriously, it's the worst. It's unpredictable. There are too many hoops for that sound to go through, and so we get echoes, we get all kinds of things. Fortunately, you sound fairly good.
Well, thanks. Yeah, it was just an unexpected hoop, but next time I'll be sure and get a landline. I have never had a problem with this up till today, of course, and it kind of reminded me of the first time I was going to come on your show a few months back, and that night you guys had a lightning strike. It's almost like the powers that be don't want us to communicate here.
Well, don't worry about it. The point is, cancer continues to move into the communities of this country and around the world with more aggression all the time. I did read the review by Dr. Rashid Buttar and told the folks about the book. How many family members did you lose, Ty?
Well, I've lost my mother, my father, both grandfathers, grandmother, an uncle, and a cousin, which I would consider sort of direct family members, but there's lots of other distant family members that have died as well. I mean,
sure.
I don't think actually that I'm an odd case. Believe it or not, I think this is sadly getting more and more normal as the cancer epidemic progresses.
It is. You're absolutely correct. I'm sure a lot of people listening are saying amen to that. It's a plague that really, well, if you go back, let's just take one person, Royal Raymond Rife, who cured cancer, who established without any question of a doubt that cancer, in most cases, in fact back then in all cases that he studied, is caused by a bacterium, which will take different forms depending upon the state of health of the body that it is in. The cancer bacterium can look like a mold, a yeast, a fungus, a bacteria, a small bacteria, a virus, and several stages that are so small you can't even see them with even Royal Rife's microscope. So we did have a cure for cancer in the 1930s. Complete, total, absolute. There's no question about it. And there is a documentary, The Royal Rife Story, at Rense.com, which I would urge anyone who has any interest in learning about cancer to get that documentary. It is stunningly well produced. The images, the sound. You hear Dr. Rife's own voice throughout it. It's a remarkable achievement. Okay, so the bottom line is we are suffering with cancer because the medical pharmaceutical mafia cartel wants us to because they profit on our misery, our dying, and our death. What is the average cancer diagnosis worth now in round numbers? It's getting close to $1 million, isn't it?
It is. It's between $750,000 and $1 million. That cancer patient is a revenue stream to the medical mafia, and over the course of all the treatments, the chemo, the surgeries, the radiation, that cancer patient can be expected to bring in between $750,000 and $1 million
now,
into their pockets.
I met a young man several months ago now, who came up to me about 6 weeks later after I had known him and emailed me and said that he had been having headaches and went to the doctors and they did an MRI and they found a tumor right behind his ear. I said, and that's the same ear you hold your cell phone up to, isn't it?
Oh, you know what? If you tell 99% of the people out there that still, they'll say that you're just a conspiracy kook or a quack. But you know what? There's so much documented evidence that cell phone radiation causes brain tumors. It's unbelievable.
Sure.
That is absolutely what's going on. I never use a cell phone anymore.
Well, he threw his away, but a little late. They actually operated on the poor kid. The cancerous tumor, it was cancerous, was involved with his optic nerve. They couldn't take it all out. So they got as much as they could. And then I emailed him a wheelbarrow full of information. Gave him the documentary on Rife and so forth. And his response was, because he has been brought up in this culture, if you can call it that, well, I'm going to let the doctors go ahead and do what they're going to do, and then after they're done with their chemotherapy and radiation, I'll take a look at these other things. Well,
that's the whole problem, Jeff, is because they have this blind faith in their doctor, but doctors have been brainwashed in medical school. I would reckon that they are some of the most brainwashed people in the entire world. They've gone through almost a decade of hardcore brainwashing in medical school, and they've been taught that only drugs can cure and treat disease, and only surgery works.
Yeah. Here's the kicker. Over 80% of doctors will refuse chemotherapy and radiation. Well over 50% of, I got it backwards. It's over 50% of doctors will refuse chemotherapy and radiation, and over 80% of oncologists will refuse chemotherapy and radiation. 80%.
Yeah, absolutely. Last time when we talked a couple months ago, we talked about that study. It was a study up in Canada, and actually, since we talked, I've had a lady in Israel has emailed me the actual statistics, and believe it or not, the percentage of oncologists in that study that would refuse chemotherapy is actually 91%.
Wow. All right. Would you please email me that study?
I will.
I will post it. See, folks, we don't have to belabor the point. They know. It's the same thing with the swine flu vaccine. The people that make it won't have anything to do with it. They know. And the flu mist vaccine, look at Rense.com. Look at the flu featured story box. The flu mist vaccine contains not killed virus, live virus. It's attenuated. It's weakened.
Yes.
But how weakened is it? And how, if someone's immune system is degraded, is a weakened virus plenty? You're damn right it is. And so even when these people get a weakened, attenuated viral vaccine, they begin to actually shed viruses for about 2-3 weeks. So they're dumping it. I mean, it's all insane. But it's not done randomly. That's the real insane part about it. It's a completely contrived conspiracy of death, dying, suffering, and profit.
It absolutely is. It's about population reduction, and it's about profit in the pockets of the medical mafia. Absolutely is. You're completely right.
We have, just as the American economic system, the Federal Reserve, the banking industry, Wall Street, is the province of Zionist Jewish Americans and Zionist Jewish Israeli citizens, because most of them have dual citizenship. This is a fact. It has nothing to do with discrimination or condemning one group over another. It is a fact. Look at the names, do the research.